Welcome to part one of how to work with Scouts with Autism Spectrum Disorders. My name is Roger Tate. My son and I have been involved in scouting for about 8 years now. He has Aspergers and was diagnosed when he was in kindergarten. The big eye-opener for me for needing adult training for adults to work with kids with autism spectrum disorders was when I worked at a Cub Scout day camp my first summer with my son, and found that out of the 13 boys I was responsible for, there was my son, another boy who is more profoundly autistic than him, and a third boy who was probably kind of borderline on the diagnostic scale. That's what really caught my attention, is how many kids we have in scouting that have autism spectrum disorders. And then that sent me searching for training materials for adult leaders and finding that there really wasn't anything out there within the scouting community to train leaders on how to work with these kids. So I've made it my mission over the last few years to try to fill that gap. I've been studying up on autism, I've been studying up on scouting methods and techniques, and hopefully with this presentation I can bring some of those things together so that you will be more comfortable working with an autism spectrum youth and more confident in your abilities to be a good part of his life. The class is going to be in 4 parts. The first part will talk about what autism spectrum disorders are. In the second part we'll talk about what makes ASD kids different from regular kids. The third part will talk about how you interacting with the parents of an ASD scout, getting off to a good start with that relationship. And then the fourth part will be working with the scout himself and with the boy leaders in his unit. So before we start though, I've got to make one last caveat, which is this is just my own work. I've put it together and given it 2 or 3 universities of scouting activities. It is not official Boy Scouts of America policy or procedure, so take it for what it is. Let's go ahead and get started with part 1. Why should we care about autism spectrum kids? Well, the first reason is because there's so many of them. In the latest Centers for Disease Control statistics, 1 in 54 boys are estimated to have an autism spectrum disorder, and that's about 5 times more frequently than in girls, 1 in 252. ASD boys are going to get steered towards scouting by the school psychologists, by their medical doctors, by their special ed teachers, because we offer an opportunity for socialization without competition, without a lot of competition. We're really the ideal extracurricular for ASD boys. By my personal estimates, this isn't anything that's official, I believe about 1 in 20 scouts have an autism spectrum disorder. I believe we see them in higher concentration in scouting than we do in the general population. And that's based on my experience working with Cub Scout day camps, attending Boy Scout summer camps, camporees, and other events where lots of kids from different units are together. My point for you is that every scouter works with these boys, whether you realize it or not. You've had that kid that was a little different, a little bit strange in your unit that you worked with, who needed a little extra help, and you will be more capable of serving that boy's needs if you're better aware of what his special needs are. Before I move on to the details of autism, I want to talk a bit about special needs scouting in general. We do, as a general principle in scouting, mainstream scouts. We want our special needs scouts mixed in with every other scout of every other diversity group, racial, ethnic, religious, etc. in our unit. It builds up tolerance, it builds up caring and empathy in all of our scouts, and our special needs scouts can both benefit the other scouts and be benefited by our other scouts. But there are situations where a scout's needs are just too profound to function in a mainstream unit. In those cases, they'd be best served with a specialized unit for that particular disability. Specialized units do exist within the scouting movement. They are typically chartered to special schools. For instance, a school for the deaf, a school for the blind, a school for developmental disorders like autism and ADD can provide a specialized unit with additional adult assistance and supervision, different ratios, and adapted program to suit those kids' needs. Also need to make notes about advancement, since advancement is one of our methods in scouting. Cub Scout advancement's easy with special needs scouts because the standard of performance is to do your best. And it's not hard to know if a special needs scout has done his best once you've been around him a while and are aware of his needs. Boy Scouting adventure advancement's a little bit trickier. In Boy Scouting, the standard of performance is to complete the requirement as it is written, nothing more, nothing less. There's less flexibility, although there's still some flexibility for the merit badge counselor, for the scout master to consider whether that scout has met the requirement. But it is a tighter standard. And then as a final note before we move on, is that if a boy really needs special adapted advancement requirements in Boy Scouting, it's a bit of a challenge. He has to first demonstrate that he cannot perform the regular requirement before he's going to be permitted to use an adapted or alternative requirement. I'm not going to comment on that as a policy matter, but it's just something you should be aware of. The last thing you should also be aware of, though, is that for a typical ASD scout, he can usually meet the regular requirements. It may take him a little more time, it may take him a little more training and coaching and a little more support, but it's pretty rare for an ASD scout to not be able to meet the regular requirements. What is autism? Autism, the name autism, was invented by Dr. Leo Kanner in the 1940s. He was a psychiatrist working with a group of people that we would now term low-functioning autism. These were people that were so disconnected from the world around them they could hardly speak. They really couldn't communicate effectively with others around them. If they said things audibly, it was grunts and groans and noises. They often acted as if other people simply were not present around them. It really kind of trapped in their own little world. So Kanner invented the term autism to try to capture that sense that one's trapped within oneself. So he used auto, Latin prefix for self, and ism, and then mashed it together to come up with the term autism. Now we recognize that the patients that Kanner was working with, that classic or Kanner's autism, is really just the extreme case of a much broader group of disorders. The milder forms go by several different names: high-functioning autism, Aspergers Syndrome, and pervasive development disorder not otherwise specified. I share these names with you not because you need to know the distinctions between them. From a scouting standpoint, our methods we're going to use will be the same for all three. However, these terms are useful to know because if a parent comes to you and says, "My child has Asperger's" or "My child has high-functioning autism," you then know that he is on the spectrum and which way to go with your support for that youth. Typically, autism is diagnosed between ages 3 and 5, and that's a point at which the normal development of a child with autism starts deviating substantially from conventional developmental standards and benchmarks. Some very important points before we get farther with this, for you from a perspective standpoint. First of all is that autism spectrum disorders, they are physiological, they are not psychological. They have to do with how your brain is wired with the neurons in your brain. If you were to compare an ASD person and a non-ASD person on an MRI scan, what you're going to find is that the non-ASD person is going to look like a lot of country highways and maybe a few larger highways in terms of how their signals get passed in their brain. An ASD brain, by comparison, is going to have more superhighways and fewer country roads. There are more direct links between their eyes and certain parts of the memory that cause some of the behaviors you will see. Very important point that ASDs are not caused by bad parenting. Even though these kids may misbehave in public, especially when they're young, it's not because they're not because they're out of control or their parents aren't trying. In fact, it's often despite the fact that their parents are trying very hard to work with them. Third point is that ASDs, they're not curable by any medical knowledge we have right now. In other words, there's not a pill, there's not a surgery, there's not a psychological treatment that will make an autistic person not be autistic. However, these people are very adaptable. In other words, the brain is a very vibrant organ, and with a lot of training, with a lot of detailed intervention, a lot of early diagnosis and interventions, of making the next point, you can really profoundly change the outcome for a person with autism spectrum disorder. They can learn to behave in a nearly normal way so that they don't stick out from society. I call it learning to fake normal. They will never be normal, but they can learn to fake normal. And the last point, especially for you as a scouter to remember, is that these ASD kids, they're not cookie cutter. Even though they may have the same diagnosis and they may have the same identity, ASD kids are going to have different sets of symptoms. This is a spectrum disorder, so depending on where they fall in the spectrum and what symptoms they exhibit, they could be as different from one another as they are from the rest of the kids in your unit. Okay, this brings us to the end of part 1, and I hope now you've got at least some sense of what autism spectrum disorders are. And you'll come back for part 2 and find the next video in the sequence and click on it. And come back for part 2, which is what makes ASD boys different from other boys.